Hello, everyone. I'm Isabella,
And I'm Jordan.
and today we're going to be talking about people with developmental and physical disabilities.
So the population we chose was the physically and developmentally disabled population. According to WHO, this includes about 1.6 million people, or about 16% of the population. These people normally have very involved family members and caretakers, and they normally require special accommodations and 24-hour care, which makes them unique because obviously not everybody needs that all of the time. The demographics for this population, about 15.3% of the population have a moderate to severe disability, and about 5.1% of that 15.3% are children. 2.9% of the population have a severe disability, and about 0.7% of that population are children. There's a higher rate of disability among women than men, and disability is more prevalent and documented in higher income countries due to their ability to survey impairments and the need for services across the country. There's higher rates of non-communicable diseases and unemployment in this population. About 66.5% of years lived for these people include having a non-communicable disease like hypertension, arthritis, diabetes, stroke, etc. There's an increased cost of living for this population due to the additional resources and equipment needed to facilitate a good quality of life. About 29 to 37% of income is dedicated to these additional costs for this population. And there is definitely a stigma and discrimination around this population that limits resources, employment opportunities, education, and healthcare availability. And this creates a knowledge deficit, unemployment gap, and poverty for this population.
Some healthcare policies that we have looked up for this project is one regarding the COVID-19 vaccine mandate. This is based on workers within healthcare workers, and they were mandated to get the COVID vaccine. And some people were not able to get this vaccine because of pre-existing health conditions. And this has affected our population because it decreases the amount of help available for them. And that is something that they have recently changed in this past August, and now it's not required. So that's a positive policy that's been changed. And another policy is with the ACA, with the Patient Protection and Affordability Care Act. This is when patients and Americans with disabilities ensure they receive healthcare options, long-term or short, that they need based on whichever disability they may have, that's affordable and accessible wherever they are. Especially in Maine, this is important because there's rural areas, especially in northern Maine, when this is a big deal. Some of our next steps we have included are specifically to Maine, which is getting more accessible and affordable activities, such as sports teams, where everyone could join, and public transportation that are more wheelchair accessible, and transportation to healthcare facilities or appointments in general is really important for these patients. Also, mental health resources would be really important. We've also included some socials and fairs that have been more up and coming recently. In this past July, I believe they had a disability day in Maine, and there was a big fair for that. Along with education is very important. So educational seminars for everyone to take would be a good way to reduce stigma and discrimination for this population.
Some available resources for this population, we decided to talk about the Robbie Foundation, which is a nonprofit organization that raises funds for adaptive equipment, technology, and therapy for this population to improve the lives and overall quality of life for children in Maine with disabilities. There's also the Disability Rights of Maine, which is also a nonprofit protection and advocacy organization that represents people with disabilities who have been discriminated against. And they also provide training on rights and self-advocacy. So these disabled people are able to advocate for themselves and protect themselves if they do not have a representative or a caretaker to do it for them. And then we also talked about Best Buddies, which is an international volunteer organization that helps establish one-to-one friendships for the disabled population, employment opportunities, leadership development, and inclusivity events for the disabled population. I know that I've seen this club in my high school at home, and I know it's present in a lot of high schools. That is a good volunteer option for like Key Club and other organizations in the school that high school students have participated in. And then lastly, we talked about Camp Pine Tree, which is Maine's only accredited American camp association for people with disabilities. Children and adults are able to come and experience independence through barrier-free access to outdoor activities. Izzy and I both personally went to this camp for our community interaction project for this class, and we both really enjoyed it and enjoyed our time, and that's why we chose this population.
And more about the Pine Tree Camp, we were in contact with Sarah, and she is the assistant camp director, pardon me, and she was the lady we have interviewed for our health disparities project. So one question we did ask her, are a couple of the health policies that she's seen take place that were positive or negative for these campers. And she did mention the COVID-19 mandate. She said that within the Camp Pine Tree, they did have a COVID outbreak in the middle of the summer that affected a large number of the staff and campers, but luckily no one got seriously ill or needed to be hospitalized. And because they work with a high-risk population, they were able to closely monitor this outbreak and get to the bottom of it. But with this policy, this was a positive policy because no one got seriously ill, but also negative for the workers that declined to work there that due to this policy. We asked her what some of the strengths of this population within Maine are, and she said that, quote, "The population that we serve at Pine Tree Camp are some awesome humans. They show heart and determination and do not allow barriers to slow them down," quote. This was a perfect way of describing the population that Jordan and I had worked with when we were in Rome, Maine. And yeah, we also asked her what are some ways we can further support this population in Maine. And she said the biggest support that's needed in Maine is transportation. As we were saying earlier, this is the biggest barrier for this population, keeping them quite isolated, especially in the winter when it's just harder to get around in Maine in general. Additionally, with volunteering and getting to know and be more comfortable with this population is huge when decreasing the stigma and allowing for more help. And then we also asked about some health disparities within this population. And she said she wants to ask access to both healthcare and recreation, as we were talking about within our next steps. She sees this as a challenge, especially because we're a rural state and a lot of isolation occurs. And she says that one of the goals that they have at Camp Pine Tree is to allow campers to come together to make connections, which will hopefully last a lifetime. And luckily, technology has been helpful with this goal, and they will continue this effort every summer as well as in, I believe, winter months. when they provide activities for everyone, such as ice fishing. And I believe they also do some ice skating lessons on the pond that they are next to, around there. And lastly, we have Sarah's information, and she's always looking for volunteers, and anyone who's willing to go have a day up there. And here are some of our references. Thank you everyone for listening, and have a great rest of your day.